remarks. The good member from the 23rd, Representative Simmons.
Thank you, Madam Speaker. When I started this session, I made my priorities, and this was at the bottom. I really didn't believe that we could pass this year, and I had low expectations. But this is a really important bill to me because I grew up in poverty and I didn't always have access to healthcare. And so increasing access to healthcare is a deep passion of mine. I was also a registered nurse for 11 years, and I worked in the emergency room and long-term care. I worked inside the prisons. I ended my career as a registered nurse for the last 6 years for the largest commercial insurance company in the nation. I'm also, through that, I saw my patients a lot of times struggling to get approval when they needed a test or medication. And that's because the insurance company has a process called prior authorization. And it's really complicated. And as a community member, I've heard stories of my friends and my family and my neighbors who often have a delay in care because they can't get the insurance company to give the prior authorization in a timely manner. This has increased costs. It's also led to prolonged hospitalizations when people didn't need to stay in the hospital, but they can't get their medication filled in order to leave. As a representative now, I hear from providers that this is a cost driver for them. They have to hire admin staff to chase down these prior authorizations, and it's costing them a lot of money, and some are having to go out of business over the bureaucracy. This bill is going to bring uniformity across all insurance carriers and a standard timeline of when they need to respond, depending upon if it's a standard request or an expedited request. We're also going to be pushing insurance carriers to get in line with technology. And we're going to be the leader in the nation where all insurance providers are going to be using electronic systems so providers can get responses more quickly and patients can get the care that they need. This has been a really great experience this session. You know, my first 2 years I was on Zoom and I was trying to move from advocate to legislator, but I couldn't work with my friends across the aisle. I want to thank the good member of the 3rd, my chair of the Healthcare Committee, and the ranking member from the 9th, because together we worked together in a bipartisan fashion, and they taught me so much about what it means to be an actual lawmaker as opposed to an advocate. We brought together the insurance companies and the providers, and before you is a really great product for the people of Washington. Thank you.
Thank you.